So it is my pleasure to introduce Stephen Hassan, who is the founding director of the Freedom of Mind Research Center, one of the world's leading cult experts, and is going to be talking to us today about a cult expert's advice on dealing with anti-vaxxers and general vaccine hesitancy. It's a pleasure to have you on today.
Thank you so much. It's an honor to be part of this prestigious conference. And I just want to correct, my last name is pronounced Hassan, and I am actually Jewish, even though most people think I am not. And I have a very different take than most participants at the conference. I'm very honored that I was invited to come. So this is a cult expert's advice on dealing with anti-vaxxers and general vaccine hesitancy. And I want to start out by just saying that for me, we do not live in a post-truth world, even though the media keeps amplifying that incorrect message. We still live in a world of truth and facts and science. And it's my position is we live in an age of influence. And currently we have been lacking the scientific tools to clearly define ethical and unethical influence in the law. PSYOPs, psychological operations, which include fourth generation warfare, which quickly to describe it, it was first written about by an American military strategist, William Lind, and then picked up with Paul Weyrich of the Christian right. But it's basically psychological warfare to disorient the target population, delegitimize experts, leaders, institutions, confuse, overwhelm, create conflict. And what I see is a war happening using psychology, using state actors such as Russia, Iran, China, as well as cults like ISIS, and many other authoritarian cult groups. So this is, for me, one of the biggest areas of contribution I want to make in this presentation. And then I just wanted to mention social media is, as we know, there's been some deplatforming, but it's really missing the tools. My next slide is to just put out there for those who are not aware of it, but the American Psychiatric Association's diagnostics, the statistical manual, or the DSM-5, has actual category for brainwashing, thought reform of cults and terror organizations, and they talk about it in terms of disorienting people's identity. So for the public, what I'm saying is this is a thing. There's a huge public health issue here that has not been clearly identified or researched to see, but it's huge. And I just want to say simplistically, but it's very important in terms of how to influence people in an ethical way, to think about it as kind of the authentic person and the cult person. Because if there's a radical personality change, that person, who the person was previously, is still there and is very, it's very doable to elicit them and empower them. And for those people born into authoritarian cults and even authoritarian families, people still have, it's an incredible thing, but people want to know the truth. They don't like to be exploited. They want love, they want respect. So there's a lot to do. And part of my work as a mental health expert is to do recovery work with ex-members of cults as well as coach family members. How did I get into such a weird field? Well, 1974, when I was 19, I got deceptively recruited into the Moonies cult. And I went and had a radical personality change and turned my back on all of my values and wanted to take over the world, and was programmed to believe that democracy was satanic, and thought that God wanted Richard Nixon to be president during Watergate, and even fasted because Moon ordered us to do so. And most young people have no idea what the Moonies are. They're best known for these mass weddings I think the record was 30,000 couples where Moon would say you and you and you had 5 minutes to decide. So that's how I got interested. So I've been doing this full time for 45 years since my deprogramming out of that cult in 1976. I wanted to share the influence continuum. I think of all of my slides, this is the most important one, and it's a way of organizing ethical and unethical influence. And I think this is a major tool that the public needs to understand, that healthy groups that respect democracy and human rights practice informed consent. I put it down here for organizations. The way they recruit, you know what you're getting into, you know what the beliefs are, and your conscience, your compassion, your creativity, your critical thinking is encouraged. It's very love-based. Whereas destructive cults use deceptive recruitment and hate and manipulation, and they want dependency and obedience. So I'm going to move on in the interest of time, but this is up on the website. I'm going to share the slides as well. But people need to have a framework to separate ethical from unethical influence. And one of the things that helped me the most get deprogrammed in 76 was learning about brainwashing and thought reform from the 50s from Chinese communist researchers. And I've reorganized Festinger's cognitive dissonance theory and added information control. But I posit, and this is the subject of my doctoral dissertation, which just was recently published, and I'm just going to read it. The BITE model of authoritarian control. I did a quantitative study on 1,044 respondents, and we came up with extremely high significance as a factor of authoritarian control. And I attempt to pull together all of these constructs in relationship to the justice system in order to be able to help judges and juries and the public understand the differences between being lied to and facts and truth. What I've developed over the decades of helping people is what I call a strategic interactive approach. And this is, and I credit Dr. Baryam for teaching me complex systems starting in the 80s. Basically educating agents, family members, friends, ex-members, media, clergy, therapists, media, etc., to organize them to do an ethical influence program to undo the unethical influence. And what this is all about is empowering people to think for themselves and make their own decisions rather than look outside themselves to some other human or to some institution that will tell them what reality is. And I have a lot of concrete suggestions for how to interact with individuals with the goal of getting them to think. And the most powerful technique, drum roll, is asking a very good question in a respectful, thoughtful way and being quiet and waiting for an answer and doing the follow-up, because it's my thesis. If you take the frame of, well, if it's true, then it will stand up to scrutiny. And if you're right, then I need to adopt your point of view. And if it isn't right, then why would either of us want to follow that? So it's a very effective frame. So what I'm advocating actually in the fight to support science and facts and critical thinking is to think about what's been happening in the world as agents who've been deliberately inculcating magical thinking and anti-science and anti-expert thinking. And the idea is to empower people online in their communities and to begin an education, a psychoeducational approach. So this is different than the way people normally speak to people involved with cult groups, because usually people try to argue with them and give them facts, which just makes them further makes them go deeper, and often alienates them. This is about building rapport and trust, gathering information, really listening carefully, and of course, finding the right person to influence someone, the right time, and the right context makes a huge difference. And I mentioned Robert Kennedy. His family has written publicly that he's really off about anti-vaccination. But as far as I know, no one's doing anything to see if we can try to help him consider evidence and reevaluate. Because if he changes his position, I think it could help a lot of people. And lastly, because I know I'm running out of time, so I talked about the BITE model. I did not go into all the components of the BITE model: behavior control, information control, thought control, and emotional control. All of these are on my slides on my Freedom of Mind website. But of the four, emotional control, one of the universal mind control techniques of destructive cults is phobias. And I've developed a 3-step phobia intervention where I basically first start with people and explain that we feel fear in order to protect ourselves from danger. And we need to be able to use our frontal cortex to identify, is there real danger or is there believed danger? And so I often start with something very benign like an elevator phobia or a phobia of dogs. And I talk about how if someone has a phobia, they have a movie in their head of something terrible happening with elevators that's plummeting to their death or being trapped forever. And they have the internal dialogue that is, I'm stuck in an elevator. And they often will hold their breath or breathe very shallowly, rapidly. So there's a cascading effect in people to make them afraid of the stimuli, the elevator, and so they won't go into an elevator. And teaching people that you need to discern structural elevators that have integrity, that have been inspected, that have emergency brakes, where you have a phone. It's impossible to plummet, and it's impossible to be stuck for eternity. And then I teach them a visualization exercise of imagining going into an elevator, riding safely and comfortably, changing the internal dialogue, and undoing the fear by deep breathing and what's called systematic desensitization. Why I'm going into this is because it's not that hard to teach. And once people understand that phobias are curable, and often not taking many sessions, and teaching people to decide is there real danger or not, and then how to systematically intervene, then I talk about how other cults, not the one the person's in, installs fears of talking to critics and former members, fears of leaving. And they will agree, oh, that's awful, and that's ridiculous, and that's a phobia. And then we come back to their group and what their thoughts is, and whether or not they think it's possible to leave and be happy and fulfilled. I see I'm running out of time almost. So I have a lot of resources on my website, Freedom of Mind. I have a nonprofit, Freedom from Undue Influence, where I'm doing further research. And I believe that epidemiological public health research is absolutely vital. And we need to educate everyone about the mind and ethical and unethical influence. And that's my presentation. Thank you.
Excellent. Thank you very much. So if anybody has any questions, please post them in the chat. So the first question is, anti-vaxxers and conspiracy theorists online, what is your suggestion about how to respond to them?
So I have a lot of blogs and a lot of advice, but basically, don't argue, don't be angry with them, don't call them names. And ideally, if you know the person, then you re-access your relationship with the person before they got into this. Oh, and I wanted to say that there's a real difference between, that's my 15-minute timer, then I'm done. There's a real difference from people who've taken vaccinations but just fear the COVID one versus people who've always been fearful of it. It's going to require a different strategic approach. But basically, the idea is to teach what brainwashing is. Now, most anti-vaxxers believe people like me are brainwashed. I'm brainwashed by the liberal media, etc. So creating a frame of, oh, you think I'm brainwashing, tell me what your understanding of it is. And then I go into what the scholars who've studied brainwashing and their models. And so it's a step-by-step interactional thing. But again, the strategy that really works isn't attacking the leader, the doctrine, or the group straight on. It's really about describing it over here with something else, getting their understanding and agreement. Maybe they've heard of NECSI. Maybe they know about Jim Jones and the People's Temple. Talking about another group and how it works, and then kind of backing your way into wanting to be free, wanting to think for yourself, and not just blindly following an authority figure. I also want to just jump in and say, for religious groups, Abrahamic faiths that say, we can't have people studying science. The Israeli politician was talking about the ultra-Orthodox not necessarily supporting science and such. My position is, however you understand God and the Abrahamic faiths, God did not make human beings robots or clones. And the idea of us asking questions is endemic to the faith traditions. So I think I talked too long on that one question.
No problem. Thank you. So the next question is, what about a healthy skepticism of experts? So a lot of them have been very wrong about their predictions about the spread of COVID, and some of them, but not a lot, have admitted that they were wrong. So is a certain level of distrust justified?
Yes.
And how does that affect what you're discussing?
Yeah, no, if people have skepticism or questions, you never want to say, oh, don't be silly, trust them, they know what they're doing. The beauty about the scientific approach is that we don't have a truth with a capital T. We have a hypothesis. We do experimentation, and we have a community of fellow scientists to reality test. And we're quick to abandon a hypothesis if it proves to be a false one. So really a humble attitude of scholars is necessary. And people who really know their stuff will say, I don't have all the answers, but here's what we know so far. We need to gather more data, and we need to figure out a strategy that makes sense.
Thank you. So we have time for about one more question here. And so one other question is, how do you do this? How do you connect directly with people, with patients, with families? When we think about this sort of at scale in a country level, how do you do this? How do you facilitate that right person at the right time in the right context?
So honestly, I've been doing this work for 45 years, but mostly for individual families who have a loved one, or for a group of ex-members of a particular group. So I need help. What I do know is we need massive education of mental health professionals, of the media, of law enforcement, of politicians. What I'm proposing really is a paradigm shift, because the law does not understand undue influence in a practical, applicable way, and it needs to. It's a desperate need right now. And as far as all of my experience and research, I've done the first scientific study to try to pull all these constructs together and to provide a formula for a judge and jury to evaluate the influencee, the influencer, and the methods used to manipulate and indoctrinate them. but we have a lot of work to do. And it sure would help to do a top-down and a bottom-up complex system approach. And so I had the audacity of suggesting that Congress invite me and my colleagues to talk about undue influence, brainwashing, and cults, and let everybody grill us, ask us questions, and present our models, because it might have a very positive effect everywhere.
Thank you very much for a very interesting talk and a very interesting discussion. There are a lot of additional questions. Sorry, we're not able to get to everybody's questions, but we will post them in the Slack channel so that we can continue the discussion after this session has ended.
And can I just respond to one question? Prevention, right? Prevention, intervention, recovery, right? Public health. Like, we need to educate young people, because in an hour or two we can preventively educate. It will take many, many, many more days, weeks, months, years to help someone once they're in the rabbit hole.
Thank you very much. It's been a pleasure having you on. Thank you.